Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. I've been doing a series called Avoiding Medicare Mistakes. You all know that as we go on Medicare is very time sensitive. There are certain decisions and timelines and timeframes that we have to live within. And so today I'm going to share with you one of the most critical time periods that you have to live with, and that is called the open enrollment period for Medigap policies. And so this is all about missing the 6-month pre-existing condition period. We don't want you to miss this pre-existing condition period. It only lasts 6 months. And so here's some instructions that I want to make sure you're real clear about. Number one, we call this the Medigap open enrollment period. Now notice, this doesn't say the Medicare open enrollment period. Medicare does have an open enrollment period for the entire Medicare population. That is every year, October 15th through December 7th. And that Medicare open enrollment period has to do with prescription drug plans and Advantage plans. Truly, it has nothing to do with what I'm talking about here, because this is your open enrollment period. This is a time in which you go on Medicare where you have this Medigap open enrollment period where you can have any Medigap policy that you want. So don't confuse your open enrollment period with the Medicare open enrollment period. Again, that's drug plans and Advantage plans. This has to do with you getting a supplemental plan. So let me explain. First off, I want you to see the B effective date. In other words, when you enroll in Medicare Part B, that's the big date. This is when that 6-month time period begins. All right, so let me just give you a couple quick examples. This is a husband and wife that I'm going to tell you about. The husband is John Smith, and John is going to retire January 1, 2021, and he's going to go on Medicare, completely retire, and he's going to enroll into Medicare at 65. And so his A and B dates are January 1st, 2021. But what really matters is the B date, because this B date is when this 6-month time frame begins to start, okay? And so he has 6 months here, so this is going to be 1/1/2021 all the way to 6/30/2021, all right? That's that 6-month period of time. And so that means that his period of time would be over after July the 1st. So these 6 months, he's in his open enrollment period. But after 7/1/2021, this open enrollment period for a Medigap policy has then terminated, it's expired, all right? So that's John's situation. Now let's talk about his wife, Jane. Now Jane, his wife, decides that she is not going to retire yet, but she goes ahead and enrolls into Medicare Part A. There's a lot of people who enroll into A. They enroll into A because they're afraid they're going to be penalized. And frankly, there's a whole nother lesson on that I've done, but you will not be penalized if you keep working and you don't take Medicare Part A. But she goes ahead and she enrolls in Medicare Part A and she keeps working. So her A date when she turned 65 was January 1st, 2021, and she's going to work 1 year later. And then she's going to retire, so then she's going to enroll in Medicare Part B, and her B date is now going to be January 1st, 2022. So what's her timeline? For a Medigap open enrollment starts 1/1/2022. It'll go all the way to the end of June of 2022, and during that 6-month window, she has no underwriting required. And then, of course, after that 6 months period is over, then she would have to go through underwriting to get a Medigap policy. Okay, so that's Jane's situation. So the whole point is, it's the B date, your B date, that's going to determine this open enrollment period for your Medigap policy. And that's what this second slide is showing. The emphasis is on this 6 month and 6 months only. So during this period of time, again, we have no underwriting required whatsoever. Now beyond that, now we have to go through underwriting, right? And so the reason that's such a big deal is this, folks, because after my 6 months is over, now I have to be approved to be able to get a Medigap policy. If I do it during this period of time, regardless of my health conditions, even if they're even serious pre-existing conditions, those are not an issue here. But once I'm into my, after the 6 months, now underwriting will be required. That means to get a Medigap policy, any of them that you would like, now you have to medically qualify. The insurance company is going to ask you anywhere from 20 to 25 health questions. They're going to check all your medications to see what you're being treated for, and they may get a statement from your doctor called an attending physician statement. And so now after that 6 months is over, now an underwriter is going to have to approve you, and sometimes they say yes, and sometimes they actually decline the application. They must approve you here, but they don't have to here. And that's why we're saying don't miss the 6-month pre-existing condition period. If you want a Medigap policy, this is absolutely the most convenient time and really the simplest time to get one of those policies, because after that, you're going to have to medically qualify. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.